Can you tell if it's a square?
If it's what?
If it's a square, then it's recorded.
Yeah.
Okay. All right, so we're going to catch urine on Scotty here. You have to do it. Come on, Scotty. I know. You're on it. Good girl, Scotty. Good girl, Scotty. Alright, so now we're going to perform our urinalysis. This is the urine that we got from Scotty. It's pretty dark and cloudy in appearance. She gave me a good amount, but I wouldn't call it an excessive volume for her size and not too small for her size either. It does have a strong odor. So I'm going to record the transparency here on my sticker. We're going to put it as cloudy. Color is dark yellow. Alright, and I'm going to start my urine strip here. We're going to put a drop on each one of these. Alright, and then this will sit here. I'm going to go ahead and put this in my centrifuge to be spun because I use it as my timer for my my urine strip. And it's going to run for 45 seconds. It looks like it's at 11,000 RPMs right now. Hit start. Alright, and then we're going to put a drop on our refractometer. And it's right at 1040 or 1.040. I'm going to use some distilled water to clean my refractometer and wipe it with a Kim wipe. I have 3 urine stickers here. One for the patient's record, one for our in-house lab record, and one on our send home for our patient. Alright. So I'm going to record the specific gravity here. Alright, when it's done spinning, so that tells me I can read my strip. We are negative for blood. We're negative for bilirubin. Your bilirubin is negative also. Ketones are negative. It looks like we are 1+ on our protein. Glucose is negative. Alright, and our pH is 8, despite taking vitamin C, and no leukocytes. So, 8 on the pH, 1+ protein, negative glucose, ketones, blood, all those things are negative. Alright, so I'm going to record this on all 3 stickers. Clean up our mess. Alright, get rid of all these things. My sample was in slot 3. Alright, it doesn't look like I have much sediment in the bottom here, so I'm going to pour the supernatant off. Alright, and then I'm going to grab the pipette, suck up what I have left in here, so if I do have any sediment, it's going to be in here. I'm going to grab a slide and cover slip. I like to use urine study stain, and what I like to do is I place a drop of my urine on here, and then I take the study stain and put a small drop next to the urine, careful not to touch the urine so that I contaminate my bottle of study stain, and that way when I put my cover slip on, I will have a stained portion and a non-stained portion, because there are some things we cannot evaluate with stain, like the cast and such. Alright. So now I'm going to pause so we can go over here to the microscope. Alright, so I'm going to evaluate my urine slide first by looking at stained portion of the slide. Alright. Urine has all kinds of things to look at, looks like. Alright, I'm going to lighten this up some. It's looking at a little bit of vaginal wash. Some squamous cells, and there's some mucus that has outside bacteria in it. But I haven't blood cells yet noted. So that is an active infection. Some bacteria, but that's not shocking on a pre-catch sample. So now I'm going to migrate over to my clear side. I don't see any evidence of amorphous debris or any urolith crystals. White blood cells. Some stem cells and bacteria in the mucus strands.
Yeah, no, don't even take a chance.
Side we do have some of this debris. So we'll record that on our sticker.
That's it.
Alright, I'll place a sticker on my in-house lab sheet. And a sticker in her chart. Put some initials next to it, and then I'll put one on her to-go home instructions as well. Alright, so now I was going to talk about some things we commonly see on our UAs. This picture here is unstained sediment that has a granular cast and several red blood cells, which are seen right here and right here. And this is unstained urine with crenated red blood cells, which are the short areas here, and then 2 epithelial cells right here and right here. You can see all kinds of different red blood cells, intact, ghost, crenated. Epithelial cells range from renal, squamous cells, transitional cells, which you shouldn't see in too large in and renal cells shouldn't be noted too often either. White blood cells, yeast, sometimes you might see sperm in your intact male dogs. Here's a picture of white blood cells with some bacteria. This is a squamous cell with a transitional cell. And then here's some transitional cells in stained urine, which in large numbers might suggest pyelonephritis. If they look a little off, multiple nuclei, size differences, it might be indicative of transitional cell carcinoma. Cast of any kind usually indicate some sort of insult to the kidneys, ranging from moderate to severe. Your hyaline casts are kind of like similar to waxy casts. They're usually clear, they don't stain. And well, actually they are easier to identify in stained than unstained sediment and in low light. You can usually see them with poor renal perfusion or strenuous exercise, or general anesthesia can also cause them. Your granular casts, you can see kind of normally in small numbers. In larger numbers, it might be acute nephritis or severe kidney damage. This is a renal epithelial cast, which can just be from sloughing or sometimes degeneration of the renal tubulars. Red blood cell cast like this can kind of be an issue. It can be a result of a bleeding disorder or trauma. This is a granular cast here that has also characteristics of a waxy cast. They indicate chronic to severe degeneration of the renal tubules. And then this one is just a regular waxy cast. They look similar to Highland cast, but they're slightly fatter. You can also usually see all different kinds of crystals. And here's some pictures of the different shapes. This is triple phosphate, which is struvite crystals, and they don't have calcium oxalate on this page, but those are the two most commonly seen ones. And there's a picture of the calcium oxalate. They're kind of more like a diamond with an X in them. This is calcium carbonate. Sometimes you see those with guinea pigs. This is the ammonium biurate. This is a calcium oxalate monohydrate form. This is amorphous debris. This one is uric acid, and these are sodium urate crystals. And this is cysteine crystals. Those you don't see too often. And on rare instances, sometimes you might see capillaria or microfilaria in the urine. You also commonly see fat droplets and sometimes sperm. Some of you might also see artifacts like air bubbles and oil droplets. Plant spores, if you're doing a free catch, sometimes sneak their way into your sample. But most commonly are using a urinalysis to further evaluate either the bladder, a process in the bladder, like a UTI, or to check the kidney function, check for pyelonephritis, and sometimes you can even diagnose diabetes if there's glucose in the urine.